Seasonal diseases arise due to the change in the environmental conditions during different seasons. For example, influenza, malaria, diphtheria, etc.
Centers of Diseases estimates that influenza has resulted in 9 million to 45 million illnesses between 140,000 to 810,000 hospitalizations and between 12,000 to 61,000 deaths annually since 2010.
On their official website, CDC declared that it aspires to create a world where people live healthier, safer, and longer. So, in a way, CDC is contributing towards the elimination of common and seasonal diseases. Apart from organizations, famous people are also trying to do something about these diseases. Bill Gates had a total net worth of $55 billion, and from that $55 billion, $5 billion are spent every year by him and his partner Melinda to work on diseases, which include seasonal diseases.
Even before he left Microsoft in 2008, Bill and his wife and partner Melinda were already building what's now the world's largest foundation. They spend nearly $5 billion a year, work on US public education, women and family planning. They get antiviral drugs to HIV patients, vaccines to the poorest kids.
Our Pakistani government has alerted health authorities and professionals at all levels regarding these diseases. To facilitate the hospitals and the authorities, the government is responding timely and effectively to the problems related to the diseases. The government is trying to provide the locals with good health care during seasonal diseases by providing them free health facilities. The government is also trying to minimize pollution, which is a main factor causing these diseases. Government is trying to spread awareness to the people through preventative measures for the diseases, which will cause minimum amount of people to be infected. The vaccines are also being provided to the hospitals by the government to prevent these diseases.
As Pakistan is a developing country, it does not have enough money to give it to the health sector, which results in less health facilities. Due to population increases, more hospitals are needed, but our country is not investing on health facilities, which means less hospitals. The more skilled doctors are not doing jobs in government hospitals due to less wage provided and are trying to get jobs in private hospitals to make more money, which results in less skilled workers for lower and middle class people. Due to less amount of staff members, timely action against these diseases is not taking place, which can cause deaths. However, the government is trying its level best to provide health facilities to the locals through making new policies.
To prevent ourselves from these kinds of diseases, the precautions are: number 1, stay away from sick people; number 2, cover your mouth and nose; number 3, wash your hands often with soap and water. Most people with these diseases have mild illness and do not need medical care or antiviral drugs. If you get sick, in most cases, you should stay home and avoid contact with other people except to get medical care. If, however, you have symptoms and you are in a high risk group or are very sick or worried about your illness, contact your healthcare provider.